right shoulder, he's been having an issue since May, to the point it's bad enough it brought him, or he's seeking care for it now. And just listening to the consult and the history, we got a couple of answers. And we know when we're talking about a shoulder, we always want to check the nerves, obviously, right? The nerves coming out of the neck. And I want to share some information about the shoulder complex. The shoulder complex is the only joint in the body, or the shoulder joint, GH joint. It's the only joint in the body under 100% neurological control, which means, yes, we have our rotator cuff muscles and our sits muscles. Those muscles are holding it in place, but they're directly controlled by the nerves coming out of the neck. Yeah, they're controlled from here. So they've had research that shows if you sever a nerve going to the shoulder, it drops, it doesn't work. If you sever a nerve to any other joint in the body, it's still going to be intact. And why is that important is because any shoulder issue, I always have to check and rule out nerve pressure in the neck. And we have a nice one right here at the base on the right side. Sir? Okay?
All right.
That's the first thing we're finding there. Now, he did mention, and this is typical, you know, we get a little injury or a big injury, and we go through these protocols, right? And the protocol is you go to the doctor, you got some pain, takes a history, do some images, there's nothing broken, so what do you do then? What was given to you or prescribed? Therapy. And in the therapy, you're doing exercises, right?
Yep.
So my question is this, everybody, is if there's an injury to a joint and there's an alignment issue, okay, how is working the muscle going to help the alignment? It may help it a little bit by strengthening it, but it's not going to ever fix it. Does that make sense?
Yes.
Yeah. And because you went through it, it made more sense. So he's got a lot of pressure down L5, I'm getting around T7, and I'm getting C7. Those are the three main pressures first today. Next thing we want to do is check motion of the pelvis. Now, can I ask you a question? Is this how you normally sit?
No.
That's how you normally sit, right?
Yep.
Now, it's been like that because of, that's just how it is?
Yeah, just
Is that most comfortable?
Yeah, it's more comfortable.
So here's what's going to happen, okay, dude? As we get the spine where it needs to be, that's how you need to be sitting.
Wow.
And what'll happen, and we've been saying this to at least the last 4 or 5 new patients that have come in the past couple weeks, that similar issue. And what's going to happen, it's going to hurt to sit the other way. And when it does, you know what we're doing. Meaning we want to get it here.
All right.
And as it starts to get there, it's going to hurt to slouch the other way. Okay, I'm telling you day one. Got it?
Got it.
Let's check the pelvis. Scoot forward. Scoot forward a little bit. Feet together, feet touching. Open and close the knees. Open wide and close. Open, close. Keep going. Open, close. Right side only. So when he does the right, you can see the whole left side goes with it at the end. Do the left side only. And when he does the left side, the right goes with it too. Scoot back for me, please. So we got some general fixation going on. Let me check the top of the joint, middle of the joint, bottom of the joint. Excellent. Tiny bit in here. Tender in there?
Tender.
Tender. Yeah. Not sharp though. Okay. Well, just doing this, the whole thing, it's not moving right there. Right there. Okay. Next, let's do static palpation. Sit up straight. Now I need you to round your back slowly, this way. Round it. There you go. So what we're looking at in the static is the tissue and color changes. Starts right about there. Right there. Tender right there?
Oh, yeah.
That one's not as bad. It's that one.
Yeah.
That one too, but not like that. Okay. Just showing. Bear with me, okay? Bear with me. You okay?
Yeah, I'm good.
I know it hurts, dude. Sacrum. more tender when I push there. That's tender. But how about that one? Not as bad though.
Oh,
That's the one. 5 and 7. Now let's check the neck. Sit back for me, sir. Any point you have questions, please stop me, okay?
For sure.
Or if anything's not feeling right, let's talk about it.
Alright.
C7. C6. Your bottom curve feels decent, a little straight. We're gonna see some different changes though in your upper neck, right in here. We're gonna focus down here. Yeah, it's actually starting at T1, right there. Sit up straight, let's check the shoulders now, please. Let me do the work. So, just gonna go bring it over and around. Is that painful to do? We can see it's not a smooth glide though, right? So that's gonna be a good test. I want to watch his shoulder. And it's just doing, it's not a smooth glide of the GH joint. Let's check this side. Uncross your legs, please. This side is a lot better, right? When
Yeah.
it's moving.
Yes.
Okay, so we want the right side to be like that. So we need to deal with T1, T7, L5 to start, and then we're gonna check the shoulders. Let's go work on your low back first over here, please.
Okay.
Let's go. Are you ready?
I'm ready.
Let's,
This can be
let's
hit.
do it, dude. Okay, face down. Face down, elbows here. Okay, we're gonna do T7, L5. Okay. You've watched the videos of adjusting, right?
Yes.
You know I don't really want to hold back too much, but I want to just give you enough to get the pressure off. 1, 2, 3, 4, 5, 6, 7. There we go. That's a piece of it. Nope. Almost. There you go. You okay there?
Good.
Great. Good. Home run. Beautiful. Let's start T1 over here, and then we'll do the rest in the chair. Bring the chin up. Chin up. There you go, sir. There. Now let's go on the other table. That low back set beautifully. Focus on his feet, please. Tell me the difference just from that.
More balance.
A little more balance,
Oh,
right?
yeah.
Keep walking.
Sweet.
Yeah.
Whoa.
You can zoom up now. So what's different?
I just feel like it feels very strange because I'm not used to walking balanced. Yeah.
Feels a little more balanced.
Yeah.
Cool.
More strength on my left arm.
Cool.
Left leg.
Have a seat there. Let's continue, okay? Feet out. Put your feet out all the way. There you go. So what's interesting is you actually do have a lot of flexibility in your neck. There you go. Sit up straight. Let's check the shoulder. Let me do the work. You feel that?
Yeah.
What's different?
Not that much restriction.
You gotta work on your wing bone now. Right hand behind your back, please. Okay, I'm gonna do all the work, okay, from here. Deep breath in. Blow it out fast. Good. Deep breath in. Blow it out fast. There you go. Back down. Now I'm just gonna do your rib, T4, deep breath in. Blow it out. There you go.
Okay.
Tell me.
I do feel less pressure here when
That's when you go to the right?
Yeah.
Okay.
Before I just couldn't
We couldn't
go
move.
past that, but now.
How about the right shoulder? Move it around. Right?
I do see a significant difference.
Now, before I scope you, I want you to do a few push-ups for me, Chris.
Okay.
Do like 3, 4, 5 if you want, push-ups, and then I want to retest. That should also, because if your shoulder was out, it was affecting your push-ups, right?
Oh yeah.
Nice.
Yeah, man.
Nice. 2 more. That's it, buddy. Now I need to set your shoulder, have a seat there. That's what I'm saying. We'll get you back on work, don't worry. Just don't move anything. Drop it down, down, down. There you go. Down. That's it. Ear. Ear. Stand up for me. Squeeze my hand. Squeeze hard. You got the power back. Cool, man. Look at that. I'm gonna go hard, go hard. It's all good. That's it. Yeah. Pretty cool, right? Nice. It's all good, man.
Awesome, man.
Nice, nice. Relax there. Good.
Oh.
Nice. There you go.
Awesome.
Good. There you go. Squeeze. That's what I'm saying. This side is stronger than that. You're all set, brother.